I like to see everything.
All right. Good evening, everyone. Welcome again to Cancer Bridges General Weekly Support Group. Tonight, we are excited to have, all the way from Jacksonville, Florida, Alexandria Denne, and she goes by AJ, so we want to call her AJ. She is a neurologic music therapist at Brooks Rehabilitation Center in Jacksonville, Florida. She received her undergraduate degrees from the University of Pittsburgh and a master's of music therapy from Florida State University. She specializes in neurorehabilitation and neurodegenerative disorders. I can speak. I work with multiple populations. She works with the multiple populations throughout a system of care throughout the Brooks Health Center. So with that being said, we welcome AJ.
Hello, everyone. I would like to first shout out Tina Fagan for reaching out to me. She was actually my piano professor, instructor at the University of Pittsburgh. She very graciously took on me and my horrible technique piano skills. So everything I know, I learned from her, and now I use piano very functionally. So we're gonna kind of switch back and forth between a little bit of PowerPoint and a little bit of interactive. So that's why I said we won't be muted for too long. Wendy, you gave me such a good introduction. I have some on my PowerPoint. All right, let's see. Can everybody see the PowerPoint? All good? Thumbs up if you can see it.
Yes.
Thumbs up. Sweet. All right, I'm seeing thumbs up. Perfect. All right, so like Wendy said, is it gonna let me? This is just a little bit about me. I was born and raised in Pittsburgh. I went to the University of Pittsburgh. I'm from Monroeville, if you're from Pittsburgh area. I got my Bachelor's of Arts in Music and my Bachelor of Science in Psychology with a certificate in American Sign Language. And then I hopped over the river and through the woods down to Florida State University to get my master's degree in music therapy. And like she said, I work at Brooks Rehabilitation. We are an integrative system of care. So we serve many types of populations. And I'm the system-wide music therapist down there. So I work with all of these listed populations here, and actually a little bit more than that sprinkled in there, but those are the main populations that I work with. How many of you, by show of hands, have heard of music therapy? Have at least heard the words music therapy? No's, yeses, no's, yeses. I see a little bit of both. Perfect. We love a good mix. All right. I'm going to tell you all about it. Whoops. So here's the fancy technical definition of music therapy. It's the clinical and evidence-based practice of music to accomplish non-musical goals. What this means is that we use music as the modality to get to a non-musical goal. So for example, if you think of a physical therapist using a weight, right? They might use a weight to help a patient get stronger. We use a musical instrument. It's wild and crazy, I know. We're gonna get into it. So to become a music therapist, you actually need a bachelor's degree or higher in music therapy. Our location requires that all of our music therapists actually have master's degrees. It entails a degree from an accredited university, a 1,200-hour clinical internship, and you also must pass a board certification exam. So that's the BC behind my MT. So I'm a board certified music therapist. And music therapists, music therapists use music interventions in order to elicit non-musical responses from clients. Populations that we work with. So what I like to say is wherever you can think that a nurse might work, a music therapist could also possibly work there. These are just a varying list of places that you can find us. Private practice, we will talk about specifically private practice in a little bit. We're in the school systems doing early intervention care. We do hospice and palliative care, that's end of life, comfort care, acute care, so in hospitals, rehabilitation, the neonatal intensive unit, the PICU, those are all the children's hospitals, aging services, including dementia, skilled nursing, assisted living, mental health, both inpatient and outpatients. I know music therapists that work in both locations, and also with pediatrics. We do a lot of stuff with pediatrics, autism, Down syndrome, neurologic disorders, cerebral palsy, and any type of developmental disorder as well. So you see, music therapists can do a lot of things, but most of us will end up specializing in one of these things. Private practice is everything. So what I really want to get into is goals in oncology. So I know a lot of music therapists that work either inpatient, outpatient, in places where people are in hospice, palliative care. You can find oncology patients, hematology patients in any of these settings. So the main things that music therapists would work on with somebody in oncology would be coping with the disorder, relaxation, expression of feelings, rehabilitation. So when people come to my hospital where I work, sometimes they'll have tumors removed, or they'll have had a tumor removed and they had another one removed before, and they need the neuro rehabilitation to kind of get them back to where they were. Typically in the setting, we'll work on motor skills, language, cognition. We also work on family bonding, legacy building, which I will explain in a little bit here, family coping, normalization. This is mostly in pediatrics. When kids are very small and have cancer, the hospital is their quote unquote normal. So music therapists can kind of help give them, autonomy, control over their environment that, they don't always have in hospitals. So that's a very big part of music therapy in pediatrics with oncology. So some intervention examples that we might have, and we're actually going to do some of these today, and it's going to be fun. You don't need to be musical to participate in music therapy. That's my favorite part of music therapy. Your fun fact of the day is that music is one of the only things on the planet that stimulates both sides of the brain at the same time. So, for example, if you're listening to a song that has lyrics and melody, one half of your brain is processing the lyrics and the other half is processing the melody, which is really cool. And I do neurologic music therapy, so we have found that through neuroscience research that music affects both sides of the brain simultaneously. So songwriting, there's a few different types of songwriting because it can be very scary for people. We can do single word completion, meaning we just change one word in a song. We do piggyback songs. So if you were to rewrite, we rewrote a song at Brooks to the tune of Jingle Bells. And instead of like the jingle bells, it's this place's name, Brooks Rehab, it's a hospital. So that's an example of a piggyback song. And then there's also original songwriting too, right? If you do have a client who is very musical, then you can work together with the music therapist and create your own brand new original song, which is really neat. Lyric analysis, this is an intervention that we use where the music therapist will either sing a song or they will play you a song and they'll facilitate a conversation. This is a lot of times done in group setting, can also be done individually. They will go through this with you and ask questions about it. You may rewrite parts of the song to make it fit your life a little better. This is a very personalized intervention typically, or if you have a group of all one setting. So for example, in mental health, they'll use this with alcohol use or drug use. Everyone in that group has alcohol or drug addiction, so they can tailor their songs to everyone in that group. Guided imagery and progressive muscle relaxation. These are techniques that can be taught to you by a music therapist. You may have even heard of some of these before. They have a lot of them online. The benefit of it being facilitated by a music therapist is that it can be facilitated to you and your personal needs. So sometimes we'll do that. Legacy building, this is for typically end of life for small children. They may do heartbeat recordings. I know some music therapists will take there's a special type of stethoscope that's used, and I can't remember the name of it off the top of my head, but they'll actually record a child's heartbeat or an adult, but a child's heartbeat, and they'll put it into a song and give to the family after the child passes. A family playlist, so this can be for the family can work together. And this actually leads into family bonding, improvisation and family bonding. This is very specific because if you have a kid who, may lose a parent to cancer or a sibling to cancer, family bonding is really important. So a lot of times music therapists will meet with the entire family to be able to facilitate improvisation through music to create family bonding. So that's that we're using music, and the goal, quote unquote, is to develop a family bonding technique. So that's a pretty clear example of that. I want to stop right here. I'm actually going to take questions a little bit. Oh, well, is it okay if I take questions in the middle? It's like a lot of information.
Yeah, absolutely. Sure. Feel free to unmute everyone.
Okay, I'm just going to stop right there because I just threw a bunch of information at you. Does anybody have a question so far about music therapy or need me to re-explain anything? No? Okay. Maybe? No? Okay, great.
They're quick learners.
I love to see it. I love to see it. All right, let me share this screen here. Gave me options for 2 PowerPoints. So I don't want to get too much into the nitty gritty of research, but like I said, music therapy is an evidence-based practice. This means that we have people in our field, whether they're pairing with neuroscientists, whether they're pairing with speech therapists, language pathologists, other mental health professionals. We collaborate a lot in this field and do a lot of research, to make sure that we are giving best practices to our clients. So I want to talk about 2 research studies. And the first research study, they took a music group and a non-music group of patients that were undergoing cancer treatments. And they found there was a significant correlation between the number of times music was used per week and the change in treatment-related distress. So this basically, what this is saying is that while they were undergoing treatments and receiving music therapy services, that their stress surrounding their treatments and, the side effects of their treatments was greatly reduced. And to test this, they used a self-test. So the researcher would just give the patient a test to say, oh, how are you feeling? Are you anxious? Are you depressed? All of those. They would answer all of the questions, and that's how they got the data for that study. The other study was done during chemo treatments. It was actually done at the hospital that's right next to Florida State University. It's called Tallahassee Memorial Hospital. And they have a cancer center there that I've actually worked with before, which is neat. And they did a non-music group and a music group with that as well. So this was during the chemo treatments. The music group demonstrated that nausea was actually delayed longer than the non-music group, which was very interesting. There's a lot of research supporting that music can physiologically change what our body is doing. So what I mean by physiologically, I mean our rate of breathing can change, the speed of our heart rate can change, and actually entrain with the music. So if you're playing slower, more calming music, that your heart rate will go down, your respiration rate will go down, and your oxygen levels will actually go up. So that's kind of the nerdy side of music therapy and where we get a lot of our interventions from. I want to share this. So my roommate is actually a music therapist at one of our children's hospitals here, and she works in oncology and hematology at a children's hospital. And this is an original song that she wrote and very graciously gave me to share with this. There's no identifying information. This is someone's name. That's why I blacked it out so nobody could see it. But if you want to, I'll give you a minute to just give it a read through. I don't know the melody, but I'll just give that a read. So this patient, I believe, is a sickle cell patient. I think so. And I don't know the age, but her and my roommate wrote this original song about her experience about having brain surgery and things that she scares about. And she loves to sing. She loves to write songs and sing in front of her friends and family. So this is a really good outlet for her. And actually, she told me that the social worker that is for the kid came back to her and said, oh my gosh, this girl is so much happier. She talks about music therapy all of the time. She wants to keep writing songs. And, you could really tell that it improved her overall quality of life, and her parents realized that. And she is a lot happier from my understanding. So they worked for a very long time on this. These things don't happen overnight. She said it took them maybe 10 to 12 sessions to write this song, and she said they have since edited it as well, so, and wrote another song, which is crazy. All right, this is the part, one of the parts where everybody gets to sing along. And if you don't know the song, it's all right. I'm gonna sing it for you here too. And I'm gonna show you an example live of, sorry, if I'm looking to the side, I have all of my chords on my iPad because it's 2022 and we use technology for everything now, including song lyrics and chords. So we're gonna do it. So if you know this song, I want you to sing along. It does not matter to me what your voice sounds like. I'm not here to judge it. I won't judge you if you don't judge me, and we will be good to go. I'm just gonna sing a little bit of it. I'm broke, but I'm happy. I'm poor, but I'm kind. I'm short, but I'm healthy, yeah. I'm high, but I'm grounded. I'm insane, but I'm lost, but I'm hopeful, baby. What it all comes down to is that everything's gonna be fine, fine, fine. I got one hand in my pocket, another one in my pocket. I heard some people singing.
I think it's hard when we're on Zoom. I think each other's voices cut each other out though, I think so. But I heard you guys singing. I love it.
Yeah, that's kind of the downfall of Zoom. But how many people knew that song or have heard it before? Ooh, quite a bit of people. So we're gonna go back to pop on our screen here. So what I would do next is I would ask the group, and you don't have to answer if you don't want to, just kind of what in general you think that this song is about, just from this little snippet, or what is this verse and chorus about? Let's see if I can. If nobody wants to answer.
I can answer.
Okay.
Your happiness doesn't depend on your circumstances. You know, you can be happy even though you don't have any money. You can be poor, you can be short, you can and you can overcome your circumstances.
Yeah, that's really great, Janet. Anyone else have anything to add, or was anyone else thinking that?
Well, I was thinking pretty similar, that taking the negative and then but looking at the positive, that's despite whatever negative is going on, there's still all of these great positive things also happening.
Yeah. So it's a balance, right? In the song, she's talking about, well, this maybe not so great thing is happening, but I still have this other thing. We do that a lot in life, where we are thinking, man, like I don't have this or I don't have that, but then we're like, wait a second, like, I should be a little more grateful for what I do have. And we have that balance. So what I would challenge in this, it's gonna make me switch the screen. Oh, there we go. So what I would challenge in this is we're gonna change this, and instead of a but, we're gonna switch it to an and. So what happens when I switch these line to an and, do they mean anything different to anybody?
It's ambivalence. Two things at the same time.
Yeah. So two things at the same time. How many people here have felt two different feelings at the same time? Everybody's hand should be up. Right. Sometimes we feel 3, 4, 5 different feelings at the same time. So I would change this song to put an and in the middle. Why? Because realistically, most people are feeling two things at the same time. And we don't have to just feel this or this. We're allowed to feel both things together. So my next challenge for you is I want you to try and change some of these words. And they don't have to be deep feelings, but maybe what you're feeling right now. Does someone want to give me a word on how they're feeling at this moment, exact moment right now?
I'm nervous and excited.
Ooh. Okay, we're gonna put that on the second time. Nervous and excited. Anyone else want to add? It's okay if you don't. We'll sing this line. I'm gonna add one. Let's see where it'll fit in here. I'm gonna change mine. Whoops. No, it changed the whole thing. Does anyone have a one-word feeling?
Sad.
Okay. So, look, we have a new song here. We have a different meaning song. So we're gonna sing this part again, but we're gonna sing our words to the song. And I encourage everyone to sing along to our new song with me. I'm broken, I'm happy, I'm nervous and excited, I'm short and I'm healthy, yeah. I'm sad and I'm grateful, I'm faded and I'm overwhelmed, I'm lost and I'm hopeful, baby. What it all comes down to, that everything's gonna
be fine.
Cause I got one hand in my pocket and the other giving a high five. Yeah. You're great at songwriting. See, you never thought you'd be sitting here on a Wednesday night writing a song, did you?
No.
No, you didn't. I hear some no's. Yeah, so the whole idea behind lyric analysis is, you know, if you're working with an individual person, having the client pick the song, you know, their favorite song or a song that they might think pertains to their particular situation. And, you know, sometimes people have a bad outlook on life. Some people have a great outlook on life, and some people just need to find that balance. So that's how a music therapist can help facilitate, just by talking through the song, talking to through the meaning of the song. And, you know, maybe we need to change the song to make it even better, or to make it reflect how the client or the group is actually feeling. So thank you everyone who participated. I'm sorry I can't see everybody's name here. All right. Who knows this song? Raise your hand. Sound of Music people, where are you at? Yeah. Okay, look, a lot of people know this song. Perfect. We're gonna sing through just a little bit of this song. I'm gonna switch it up on my song here. Also, if you play music, OnSong is a great app to have. I know, Tina, I think they have another one for specifically piano music, but this is for like guitar music. All right. If there's people in the group who don't know the song, this is going to give you a little brief intro into what it sounds like. Ooh, hello, doggy. Sing along. Raindrops on roses and whiskers on kittens. Brown paper
Packages tied up with strings. These are my favorite things.
cream colored ponies
And crisp apple strudel, with bells and sleigh bells and schnitzel with noodles.
wild geese
My
that
geese
fly.
that fly with the moon on their wings. These are my favorite things.
Girls in white dresses,
Dresses with blue satin sashes, snowflakes that fall down my nose and eyelashes, silver white you are my favorite things.
and the dog bites,
Bites and the bee stings. When I'm feeling sad, I simply remember my favorite things, and then I don't feel
So bad.
yeah. Beautiful. I love when everybody sings with me. I always tell my clients, I said, I don't do solos. Someone's got to sing with me. All right. Who's ready to actually write our own song? We're going to do, I want to get to know some of you. So we're going to talk about our favorite things. So I want as many people who are willing to participate because we have a lot of blanks we need to fill in here. You can choose, explain in person. You can choose your favorite color, your favorite food, your favorite activity, something you like to do, something about your favorite place to go visit. I'm sure for Wendy, that's probably Florida Keys right now. So yeah, I just encourage your participation just to contribute a word, and you might get to learn something about somebody else. So I'm going to go back and share the screen. Just ignore all of the letters up here. Those are my chords so that I didn't have to switch screens. All right. I'll go first. I'm going to give my favorite color, and we might go back and switch some of these around. Has anyone else got a favorite color?
Purple.
Ooh, purple. It's my second favorite color. We need one or either two more colors or one more thing.
How about green?
Green? Now we need one more color because it'll be pink and purple and green and
Blue.
blue. Beautiful. Okay, should we keep the categories? Maybe let's do favorite food.
cookies.
Cookies.
Pizza.
Someone say quinoa?
Pizza.
Pizza.
Oh, pizza.
Maybe pizza and cookies.
Yeah.
Pizza and cookies.
Pizza and cookies. All right, we'll switch it.
Yeah, pizza and cookies.
Pizza. I love the teamwork. Pizza and cookies.
Mm-hmm.
And so this one can either be, oh, go ahead, Tina.
Chocolate pudding.
Oh, okay, yeah, I was just gonna say we need a two. Chocolate pudding. I love chocolate pudding too. Okay, so pizza, Pink and purple and green and blue. Pizza and cookies and chocolate pudding. Ooh, this is a long one. So this can either be like going or something vacations with all of my friends. These are a few of our favorite things. So this can either be like a long phrase saying like where you like to go with who, or we can stick with the blank and blank and blank and blank.
I like the vacation idea.
The vacation, okay, so.
Vacation, yeah, some kind of vacation.
Okay, so vacationing.
At the beach.
Let's do this. Beach vacations with. Who said the beach?
I did. How about wonderful friends?
With wonderful friends. These are a few of our favorite things. All right, let's sing it. Let's see how it sounds and see if we need to make any adjustments. All right, here we go. Ready, go. Pink
Pink and purple and green and blue. Pizza and cookies and chocolate pudding. Beach vacations with wonderful friends.
These are a few of our favorite
Things.
Yeah, I think it sounds good, but it's your song.
You guys are great.
This is awesome. Okay, let's keep going. Let's do, does anyone have a category they would like to do?
Animals.
Animals, oh, that's good. So like favorite animals, or like if you have a pet and maybe their name, let's see what we can come up with.
Okay.
What you got?
I have two dogs, Jacob and Copper.
Okay.
Jake and Copper.
Let's do family dogs. We might change it. Let's get the words down and then we'll rearrange. Any other types of pets that we like, or even just your favorite animal in general?
Donkeys.
Did two people just say donkeys at the same time?
There was a monkey and a donkey, I heard.
Oh, okay.
I just saw a monkey on TV. I thought it was hilarious.
Okay. We have family dogs and monkeys and donkeys. I love it. Whoops. No. Chickens?
Chickens.
All right.
They make me laugh.
Llamas and sloths.
Okay. Let's see. It might work. We'll leave it for now. We'll make it happen.
How about chickens and llamas and sloths are funny?
Chickens and llamas and sloths can be funny.
Mhm.
That works. Okay. Anyone want to say maybe like what they like to watch on TV, or, you know, if some of the guys like sports, some favorite sports teams? Girls can like sports too. I'm sorry. I love the sports. I love the Steelers. What'd you say?
Westerns. I just watched the Western.
Oh, Western, like a movie?
Yeah.
All right. We're going on movie types. What other types of movies do we like?
Rom-coms.
I think that might work. Are we okay with I love to see
Mm-hmm.
or watch? I don't know, let's sing it. Let's sing it. Well, we're gonna start from Family Dogs. All right, yeah, Family Dogs. Ready, sing. Family Dogs and
monkeys and donkeys, chickens and
llamas and
swans can be funny. Westerns and rom-coms.
love to see. These are a few of our favorite
Things.
What do we think?
Sounds good.
Sounds good?
Yes.
All right. Okay, moving on. We're going really fast. I love it. Does anyone have an idea for a category here? Something with something.
How about weather?
Zoom
Oh.
chats with friends.
What chats with friends?
Zoom chats with friends.
Ooh, I like that. Who said that? Can you say your name if you don't mind?
I'm Lauren.
Hi, Lauren. I love that.
Mhm.
Okay, so it's to be Zoom chats with friends. Let me see what part. With blue satin Sasha. Okay, Zoom chats with friends. And I like to go for coffee. I'm gonna add, you guys can learn something about me. I'm gonna write going for coffee. Coffee is part of my personality. People don't think it's a personality trait. I think it is. All right. So this is the part where it's like girls in white dresses with blue satin sashes. So we have Zoom chats with friends and going for coffee. This
Walks
is
in
also,
the park.
ooh, walks in the park. Walks in the park and
Blue colored skies.
blue colored skies. Yes. So this last line is the silver white winters that melt into springs, but it doesn't have to be weather related.
It fits though. We can't tell if it's winter or spring.
Oh, that is, we can keep it. We can keep it. Okay, let's do show of hands. Do we want to keep that line? Silver white winter.
Yeah, it's good. I like it.
Yeah, okay. I think it works pretty well. We'll keep it. It's our song. We can do whatever we want. Silver white winters that melt into spring. Well, not spins. Spring.
Jake, it's not your turn. You have to wait.
All right. All right, let's sing it. Zoom chats. We're starting. Go. Zoom chats with friends.
Going for coffee.
In
Walks
the
in the park and blue
colored sky.
skies, silver white winters that melt into spring. These are a few of my favorite things.
Okay, this is the tricky part because this is the part of the song where it goes, when the dog bites, when the bee stings, when I'm feeling sad. Okay, so the last one, we're going to keep it a feeling.
Okay.
When the snow comes in the
Ooh.
middle of April, it makes me feel so mad or cold.
That was brilliant,
yeah.
Lauren, brilliant.
It makes me so mad. Let's see. Wow, that is amazing. So when the snow comes, and it's April, It makes me so mad. Yes. Okay. Sing the whole song. We don't need that. We're gonna sing the whole song. Full screen, so everybody can see it for good. All right, are you ready to sing your song you created? From the top. It'll be the last time you have to hear it until you decide to turn it on Spotify. But it won't be these cool lyrics. Ready? Pink and purple,
Purple,
green
green, and blue.
sky
Pizza and
pudding.
pudding.
Each
Each
vacation,
vacations with
wonderful
wonderful friends.
these
You're a few of my favorite things.
family, dogs,
And monkeys and donkeys, chickens and llamas and sloths can be funny. Westerns and
moms that love to see.
see. These are a
You
few
are
of
our
my
favorite
favorite things.
Zoom chats with friends.
Don't work for coffee. Black American skies. Silver white winters that melt into spring.
You are
My
my favorite.
favorite things.
When
When
the snow comes
and they say,
it makes me so mad. We simply remember it, and then we don't need you.
so
So
bad.
yeah, that's an excellent song.
Great job. That's awesome.
You all should be proud of yourselves. You made a song in like 15 minutes. Well, it'll be recorded, so you can all take a picture of it and sing it to yourselves.
There you go.
All right, so even though I'm in Florida, and you're probably all thinking, oh my gosh, music therapy, it's so cool. I want music therapy. I want everyone to know about music therapy. Well, you're in luck because I compiled a list that Wendy will probably send out to everybody. I have it on a document of all of the local private practice and non-private practice and practicing music therapists in your areas. So if you see on the list, it says at the bottom where they go, and then some of them are virtual. There's 2 pages worth here of all different areas. And you see some of them specialize, some of them are pediatric, some of them are hospice, some are virtual, some are not. And I included as much information as possible. All right, let's do questions, comments.
So let me stop sharing so you guys
Sure.
can, I'll make you guys in